Here's what most people don't find out until it's too late. A lot of practices offer every full mouth implant patient the same treatment plan, same process, same timeline, same approach, regardless of your dental situation, your health history, or your overall expectations. They're fully booked while you're living with a result that never felt quite right. I'm Dr. Larry Dougherty, and I've been a cosmetic dentist for more than 17 years. And in the next few minutes, I'm going to walk you through exactly what you should do and what you should know before you commit to full mouth implants. Because you know that moment when someone pulls out a camera at a family dinner and instead of smiling, you just turn away? Or laugh with your mouth closed? Maybe it's not even the camera. Maybe it's a job interview, and the whole time you're thinking about how you're coming across. Not because of what you're saying, but because of your smile. And that voice at the back of your head just won't quiet down. It happens to a lot of people. So if this sounds like you, I want you to know something first. Sometimes the most successful, caring people I've ever met have walked through my door feeling embarrassed about their teeth. They've become so used to their smile and their teeth that they decide to just live with it. Perhaps they've been wanting to get their teeth fixed, but they've been putting it off for years, sometimes decades, because life got too busy, or it felt too expensive, or they just weren't ready to face it. And really, there's no judgment here, none. Life happens. Teeth are complicated. And the fact that you're watching this right now tells me you're ready, or at least you're getting there, which is great because full mouth implants are not something you just rush into. This isn't like getting a filling or even a single crown. It's a life-changing decision. And if you do take that leap, this treatment can give you decades of newfound confidence, function, and comfort. But remember, you have to do it properly, otherwise you'll run into regret. So the goal here is simple. Don't act on impulse. Instead, move carefully and intentionally so you make a decision you feel good about. Not just next month, but in 10, 15, 20 years from now. How do you do that? Well, it starts by understanding what this treatment really involves. Now, if this is something you want to explore further, my door is open. You can find me in Garden Ridge. Just click the link in the description below. But first, let's start with the basics. Because in my experience, most people who come in for a consultation technically have a general idea of what implants are, they're just not always 100% certain about a few details. And that gray area, it's actually a big part of what makes this feel overwhelming. So let me clear it up for you. A dental implant is essentially a small titanium post, about the size of a screw, that gets placed directly into your jawbone. Think of it as a replacement tooth root. Now, here's what people probably don't know about implants. Over the following weeks and months, that titanium post actually fuses with your bone. Your body accepts it and integrates it, almost like it was always supposed to be there. And that process is called osseointegration. It's the main reason implants feel so stable and so natural once they've healed. But besides that, it's also what makes them fundamentally different from removable dentures. See, removable dentures sit on top of the ridges where your gums and teeth used to be. They can shift, they can slip, and over time, they can actually cause more bone loss. Implants, on the other hand, are anchored into the jaw, so they don't move, and they actually help preserve the bone underneath. Let me explain. When your teeth are missing, it's natural for the bone in that area to slowly shrink over time. That's what leads to that sunken look around the mouth, like this one. Well, that doesn't happen with implants, because they stimulate the bone the same way natural tooth roots do, which means it helps maintain your facial structure. But does this actually work? What are the odds that this holds up long term? Fair question, and here's my honest answer. There have been a lot of studies on this topic, and one in particular says that 5-year success rates for dental implants exceeds 95%. If you really dig into this research, 95% is actually pretty misleading. The truth is, there are some doctors that place implants that have lots of failures, and there are other doctors that have less than 1% of their implants ever fail. The skill of the surgeon is one of the biggest determining factors in implant success. So, implants aren't really just a simple cosmetic fix, even though they're sometimes talked about that way. In reality, they're a medical solution with long-term health benefits for your bone, your bite, your nutrition, and honestly, your overall quality of life. But that's not to say that everyone should jump straight into full mouth implants. Because one of the biggest factors in whether your implants succeed long-term isn't the implants themselves. It's actually the evaluation and the planning that happen before anything is placed in your mouth. And that's where the process really begins. When a patient comes to see me for a full mouth implant consultation, here's what I'm looking at. First, how much bone do we have to work with? Your implants need something solid to anchor to. Meaning, if there's significant bone loss over the years, which is common with tooth loss, we need to know that going in. Secondly, how generally healthy are you? Your medical history and any medications you're currently taking. That's because certain conditions and medications can affect how well your body heals. So things like uncontrolled diabetes, blood thinners, or medications that affect bone density are all things we have to take into account. I mean, they're not necessarily deal breakers, but they're definitely factors we need to understand so we can plan around them properly. And third, lifestyle factors like smoking. I'll be straight with you here. Smoking significantly impacts healing, but more importantly, it can affect how well the implant integrates with the bone. So if you're thinking about this procedure and still smoke, you should probably quit before you make this investment. Perhaps we need to do a little extra groundwork for this treatment to work. The most common example is bone grafting, which is common in patients that have been missing a lot of teeth for a long time. This is where we have to rebuild the foundation so the implants have the support they need to last. Again, taking extra steps should not sound alarm bells in your head. This is just us being extra cautious because we want to achieve the best results possible. That's why I completely understand it when patients in their 60s or even 70s come up to me and ask, "Am I too old for this?" Well, in most cases, age alone is not the deciding factor. As we've already talked about, your overall health and healing ability matter far more than the number that's on your driver's license. I've treated patients well into their 70s who were excellent candidates. And really, all it boils down to is this: proper planning and clear communication. So if you want to know whether you're a good candidate for dental implants, you know where to find me. And as part of our consultation, we're gonna have to get into the nitty-gritty of this whole procedure. Yeah, I know. When you see it laid out like that for the first time, it can look a little intimidating, maybe even scary. But after doing this for a while, I've come to realize that fear almost always comes from the unknown. And the moment something stops being mysterious and starts being predictable, it becomes a whole lot less frightening. So let me walk you through what this actually looks like from start to finish. Step 1, imaging and planning. Before we do anything to your mouth, we need to get a full picture of what's going on inside it. We use 3D imaging, 3D scans, and regular photography to capture images of your bone structure, your nerve pathways, your sinuses, your current smile, an ideal smile, basically everything. And this is a crucial step because this is where your entire treatment gets mapped out with precision, which brings us to step 2, surgery day. This is where our oral surgeon uses IV sedation to put you to sleep, remove any remaining teeth, and place dental implants into your jawbone. Patients don't have to worry about pain or noises or anything negative they associate with past dental experiences because they're sedated and usually don't remember anything after. Once the teeth are out and the implants are in, on to step 3, attaching your temporary teeth to your implants. Many patients are concerned they'll leave the office without teeth, and this doesn't happen with our technique. We attach the teeth to the implants right after they're placed. This is a totally tried and true practice, and we have been doing it for many years. After that, we move on to step 4, the healing period. Okay, I want to be clear here. You're not going to leave our practice with your final teeth yet. We still need to let the titanium implants fuse into your bone. And this usually takes about 3 to 6 months. Like I said, during that time, you'll have temporary teeth, so you're never walking around without teeth or with removable teeth. You'll have teeth attached to the implants the entire time. We do encourage a soft diet during this time so the implants can heal and you won't break anything. Then, after the foundation's fully set, it's time for step 5, placing your final teeth. And I know, based on my past patients, this is the most exciting part of the procedure. Not only will they have a great looking smile, but they'll finally be on an unrestricted diet and can eat whatever they want. Each step is its own milestone. Yes, the full timeline takes time, months in most cases, but every single week of that timeline has a purpose. And when you understand what's happening and why, the whole thing feels more exciting. Which is what will make the entire thing worth it. Because I know that as much as I talk about what dental implants are and how they work, there's gonna be that one thought at the back of your mind, the cost. And I'm not gonna dance around it, because by now, I think you've already Googled it, you've seen the numbers, and the last thing you need is someone sugarcoating the price like it's nothing. Well, I won't do that. Full mouth implants are a significant investment. It's 2026. Per tooth, you're typically looking at somewhere between $5,000 and $6,000. If we're talking about a full mouth case that's totally fixed, nothing removable, that total can also feel shocking. We're talking about anywhere from $45,000 to $60,000. So let me help you understand what's actually behind that number. And there's a few things that drive the cost of an implant. First, the complexity. A straightforward case with good bone density is going to look different from a case that needs bone grafting or other preparatory work. Second, the materials. The implant posts, the abutments, the temporary teeth, the finals. These are all precision crafted, medical grade components that cost money to make. And third, the team and the technology involved. 3D imaging, surgical planning software, the experience of the clinicians placing and restoring your implants. All that's factored into what you're quoted. See, these are all the technical things. And I understand you need to know these things. But I think the most important question isn't how much does it cost, it's is it worth it? And there's really only one way to answer that question. Think about what you've already given up because of your teeth. The food you avoid, like corn on the cob or a good steak. The photos you've ducked out of. The moments when you caught yourself covering your mouth mid-laugh. Or the mental energy spent managing something that should just work. With implants, all of those worries will be gone. You can eat what you want. You can speak more clearly and confidently. All you have to do is wake up and your teeth will be there, a part of you. It's fixed, stable, and most importantly, yours. Now, if you've made it this far in the video, I know one thing's for certain. You're not looking for the fastest answer. You're looking for the right one. And your concerns about pain, failure, uncertainty, or wasting money are completely valid. And those are smart concerns. And that's exactly why education comes first. In my experience, regret rarely comes from the implants themselves. It comes from rushing, from unrealistic expectations, from poor planning, and from choosing based on price alone. You see, when full mouth implants are carefully evaluated and thoughtfully designed, they can be one of the most life-changing treatments we offer in dentistry. But they're not a one-size-fits-all. That's why the next step is making sure everything is crystal clear. Because when you walk into a consultation fully informed about what you're getting into, there won't be any surprises. You've basically rehearsed the outcome, and that allows you to make a decision you can feel good about. But if you've still got questions, you can always book a consultation with us, and we'll answer anything you want to clear up. You don't have to worry about anything because there won't be any pressure at all to take the next step. The entire purpose of the consultation is to have a conversation. So this is pretty much a win-win situation for you. If you're ready to do that, click the link in the description and schedule a consultation.